Step one for extubation is to verify your order. You want to check for contraindications to the extubation, and you want to also make sure you have emergency intubation equipment available just in case the extubation does not go well. After you have verified the order, you want to obtain your equipment, and that includes oxygen delivery device, a suction catheter, scissors, and a syringe. After you have obtained your equipment, you want to put gloves on and introduce yourself and inform the patient of the procedure. You want to also put them in a semi-Fowler's position for the procedure, and you want to assess their heart rate, respiratory rate, SpO2, BP. After you assess, you want to assemble the oxygen delivery device to put on after the extubation. After you've done that, you can suction the patient above the glottis and below the glottis if they need it. You definitely want to make sure you get above the glottis because you don't want them to aspirate any of the fluids that have collected there. After you have suctioned the patient, you are ready to assemble the anchor and make sure that it's in a position that's available after the procedure. Once you've assembled the anchor, you can deflate the cup and check for any air movement around the ET tube. You may need to occlude the end of the tube to make sure you feel air around. Then you want to reinflate the cuff. After you reinflate the cuff, you are ready to cut the tape and remove it. To make sure you have maybe an assistant with you to help stabilize the airway after you take it off. Once you have taken the tape off, you want to inform the patient to take a deep breath, and then you want to deflate the cuff, have the patient cough. While they're coughing, pull out the ET tube, and make sure you put the oxygen delivery device on the patient. After you have done that, you are ready to assess the patient for, you also want to make sure they cough repeatedly. After you do that, you need to assess the patient for laryngospasms, edema, stridor. You want to make sure their heart rate's okay, respiratory rate, SpO2, blood pressure. After you have assessed that your patient is doing fine, you also want to auscultate as well and assess their general appearance. After everything is okay, as far as that goes, you can chart, take off your gloves, wash your hands, chart, inform the RN if she wasn't already in the room, and then you want to assess the need for bronchial hygiene or maybe lung expansion therapy. That's it.